morning, everybody. This is Dee Reinhardt with Illinois WorkNet, and Olivia's on the road to Quincy right now, so she's not going to be with us. Destiny is one of our project assistants, and she's going to watch the chat pod so that in case there's any questions that I don't see while I'm doing demonstrations today, she's going to ask me those questions. And then we've got presentations today by Catholic Charities and OAI. So when we get to those, since those are Cook County agencies, I will invite the southern agencies to leave if they wish. Otherwise, they can stay on the call and listen. We're not protecting anything here. We're just giving you the opportunity to move on with the rest of your day. So let's start out with dashboard numbers. And what we've got going on is a lot of new things here, but just to let you know, we are currently at, I'm going to try and get the exact number for you, of the new cohort customers. We're over 200, so that's really good, and I think we're starting to approach 300 at a statewide level. So I'll give you that number in just a minute. I did these numbers last night, so if you got in and you checked on things, we're at 323 for a statewide number of people that have been referred back and forth. I did these numbers last night after everybody should have been gone, so if you worked on anything this morning before the webinar, then these numbers might be off a little bit. We do have 3 people from Lower North that have an invitation pending, and as I'm looking this morning, there's actually 8 total, so we've got one more in here. So, and then we've got a number of these that are past due that have not been accepted within the 2-day time period. So if you guys want to go in and take a look at those, Roseland, you've got 3, Mid-South, you've got 3, South Suburban, you've got 1, Southeast, Uptown, and West Suburban. And then eligibility pending and eligibility past due, there's 1 of each. So that's pretty good. Appointment not scheduled, we've got just a few odds and ends, and then appointment not scheduled past due. South Suburban, you have 7 sitting in there. So if you need some guidance on how to get that accomplished, I am going to be showing today in test how you can schedule those appointments if they are past due. We do have quite a few numbers of referral pendings, appointment not scheduled for regular customers. These are the re-engaged customers. Mid-South, it looks like you're the big winner with 15. And then there's a few 7s in there. Northwest and Roseland, 10, 11. Southeast, you've got 11. Uptown, Western, and Rockford, you all have 7 each. So please take a look at those customers to make sure that you are getting them scheduled either to you guys for an appointment to see if they're still wanting to participate or need to participate, or to the actual agency itself. No-show CBO intake, we've got a few odds and ends here. Quincy, it looks like you have 13 that have not shown up at the and it just told me that my connectivity was lost. Again. Okay, if there is an OK behind it, I noticed a case note that indicated that DHS is aware of what's going on and there's an appointment scheduled or soon to be scheduled. So the 2 at Decatur and Quincy, those 2 customers need to have some sort of action taken by you because the referral was rejected, we need to at least have a case note in the file so that I can see it to let us know what's going on with those particular customers. We have 3 that were not appropriate for services, so you need to take action on those. And there were a number that were recommended for sanction. East St. Louis, you have 4 in the list. Otherwise, it's all 1s. So any questions on any of these numbers? All right. So you guys can see the screen, right? So we're good, right? Okay. All right. We're taking care of things. We're getting things done, so that's good. All right, I'm going to minimize this screen, and we're going to move on to how do we close a reverse referral that was verified and then not accepted? Leslie, we may have to talk afterwards. Are you talking about the agency referred you, they went back for the appointment, and then they rejected the referral? Is that what I'm, okay. And was it at an agency in Decatur, or was it at an agency that doesn't have another option? So you could refer them to the other provider in Decatur, since there's 2 in Decatur. Oh, the customer got jobs? Are they exempt then? Leslie, did you dial in, or are you on your computer speaker? All right. Call my home office number after we're done. I'm going to type it in here, and then we can talk about what's going on with that and how you can deal with them in the system. Okay. Change appointment dates. On the customer file, if you're looking at a customer and they need to have their dates changed, I'm going to go to Candy Apple here. When you are working with a regular customer, not a new cohort customer, and they need an intake or a CBO intake appointment, and they need to be scheduled, and they've become eligible again after coming off of a sanction, you do it from the progress page. So on the progress page, you've updated their status. You can come down to the initial CBO appointment, 2151 upload, and then schedule an appointment. And you can pick a date from in here. Now, I don't happen to have any appointments for this particular office and customer, so then you can just schedule the appointment from here. It will create a new 2151 for that customer, and my suggestion to you is that you download a 2151 and print it, either PDF, and save it to that customer's, I'm sorry, I'll open up my screen. Destiny, you should have told me that. All right, so from the progress page, and the initial CBO appointment, you schedule an appointment, you just pick on an appointment, and then download the 2151 form so that you've got it in your IDS files, and then if the customer happens to be there, hand it to them. I have seen a couple of people upload the initial appointment date so that it is on file in the customer record on Epic. The date on a 2151, if I click on this 2151 right now, the appointment date was 5/18 of 2016, but it's giving me today's date. So if you want that paper trail, then you need to create the 2151 that day that you're creating it, save it as a PDF, print it, do whatever you need to do. PDF is probably less paper. Then file that. And like I said, you can upload it to the customer's file in Epic and or IES. This is just in case you need it down the road. If this is a customer that has had some sanctions, it might be worthwhile to have that paper trail. Okay, moving on to the next item on the agenda, we have the control group updates coming out. I'm hoping to have those all ready to go by midweek next week. We're hacking away at it and we're getting it almost ready to go. I will have a training video done as soon as I have all of the parts and pieces on the page. So I'm hoping to get that this afternoon, but it might not be until Monday. So on the control group, and just to let you know, the most current directions for the control group reporting as well as the new cohort directions are both in the file pod in the lower left corner of the webinar. So if you click on the file, you can download it to your desktop and you can then come back to the webinar. But make sure that you get these. Otherwise, if you forget, they are on the Epic Partner Resources page. So on here, we go to customers. And on the customers, what will happen is the control group customers who do not have an agency assigned to them will need to be all customers who were part of the original cohort, the customers who were randomly assigned. Those customers will need to be associated with an agency if they are not already. And we do have quite a few customers who were already assigned to an agency. We're going to get that uploaded into the system so that those are there. But we have about 150, I'd say, maybe close to 200 of the 2,300 that do not have an agency associated with them. So what you would then do is you would take a name, and I'm going to use brown color. I'm going to verify their birth date. So this is 05/02/1982. I'm going to search for that customer. It comes up telling me that they're out of Mid-South. I click on the Assign, and I'm going to assign it to a safe haven. You have a drop-down list here of agencies that you could assign them to, so depending on where you are located, that customer would have agencies that you can select, from which you can select. So I save that. The customer is now assigned. I can move on to another customer. I go to the control dashboard to see any of these customers. I go into control. As DHS, you will be able to see this row that says customers who are not associated with a provider. I have 14 in here. This is from test. And this is customers that you may need to assign to an agency. Otherwise, customers who are associated with an agency are in this top green row. We do have some more completed information that's going to be added to that dashboard. What you will need to do, this is a reporting tool. So we're going to go to Progress. It's not a communication tool. What's going to happen with this is the CBOs are going to upload the information that is associated with those control group customers. We will have instructions right here at the top, and as a customer reports, you pick a time period. So for example, I'm going to pick 05 of 2017. I'm going to select that time period. I know that this customer, the CBO is going to enter in most of the information, but I know for that month of that customer was on sanction. So I'm going to go in here. I'm going to put in the 5/1 date, and I can click by year, and I can pick May 1. Sanction reason was failed to cooperate. Got to spell it right. Cooperate. And then you can save this information. Once it's submitted, the record is no longer editable, and so you have to just go in and save. And then when the agency completes that month for that reporting period, they will see this, and they will be able to add that information in there. Now, yeah, I'm sorry. Hopefully you can see the recording a little bit better. The directions are in the screen, in the file pod below. Let me see if I can switch. Let me see if I can switch here. And so I need to find brown color again. Brown color. All right. Juan, can you see this better? I don't know that we can come up with that unless you provide it, Deidre. So if you can give us a drop-down list of things, I need it today, because he's almost done programming this. So the sanction reason here would be entered if there is a case that's been canceled. You would enter that in here by just unchecking the box, entering the date, and entering the case canceled reason. And then if a customer has been re-engaged. Otherwise, the CBOs will be entering information from staffings that they went through with you, or documentation that has happened. So for historical purposes, this is getting reported, and this is going to be in the system. It will come to a report that Deidre Wesley will be using for our study team. And then you can go back in if you want and look historically at information that has been entered. Now, this has not been a submitted month report, and you can look at it in view. Deidre, let's talk after the webinar. And then under Edit, if I go to the next month and I have submitted data, if I go to 6 of 2017, so I'm just going to go back to that 5 of 2017, and I submit this report, submit, and then on here, if I go to the next time period, so you'll see now, if I look at this history, it's been submitted. I go back, I look in, I'm going to go to 6 of 2017, and I hit select, and I pull data, the provider, intake information, vocational training, and education. I pull that forward, then it tells me that the sanction date was 5/1/2017. They'll still be sanctioned for the second month, I believe, and then you can submit that. What you might want to do is put the end date. I'm going to say 7/31/17, and then save. And since the customer is sanctioned, I'm going to go ahead and submit that report. So that customer is basically done, and if the agencies know this information, then they can enter it. But if it's a customer who was never assigned to an agency and you need to assign them and say they were sanctioned or they were ineligible, we are adding a couple of extra lines in the report here that are not currently in here. He's got them in test, on his local computer in test, and we're just getting this finished up here. So, any questions about the control group? You still need to, for the voluntary counties, you still need to report what was going on with the control group customers who were randomly assigned. In most cases, that's going to be applicable to the CBOs, or if the case was canceled, then that would be information that would get entered in here. Yes, I just picked a safe haven, Pam, because it's easy for me to do a safe haven. We just used it as test. No. We are not turning the control group into treatment customers. This is control group reporting only, and if you notice, this page is a whole lot different than anything else on the treatment group customers. So these are, if I look at my list of agencies that I can select from, they are Safe Haven and Springfield Urban League. So I only had 2 options. Okay, good. Will the process now be when a customer in control or treatment is sanctioned, we then need to complete this new page? Treatment is different. Treatment group is the regular progress page. That's where you will mark them. If the customer is currently in process and is in the control group, and the CBO is not entering this information, then you may need to. In most cases, the CBO will be entering most of the information based on staffing meetings that they have with you. They might not necessarily know the dates for the sanction, so you may have to enter and save that information now. How would who know they are sanctioned? The agencies, because you had a staffing report with them. You had a staffing meeting with them. Then they would know that the customer is sanctioned, and they could enter that information. Okay. All right. Let's check the next item on the agenda, EPIC updates. I will include all of them in the notes that come out, but a number of updates that have taken place are items that I can share with you verbally here. I will make sure that they're all included in the notes. We have a new row in the, I'm going to go back to the dashboard. On the enrolled dashboard, let me make this a little bit bigger. We have a new row right here that says application incomplete, no contact, or referral rejected. So this is a new row that you can look at. The other thing that we just recently did was on your list of customers, let me go back to, on your list of customers, and this won't be a good demonstration for you, but on this list it will tell you the individual office from everyone on here now. It no longer will have the pod offices listed and then the feeder office has to be found in the export. Right now, all of the offices are listed individually. We made that change. And then we will be adding control group customers into customer groups. In a new cohort invitation, let me go to that so you can see it. On the new cohort invitation, we have an eligibility reason at the end of the row. So, for example, Kyle Adams is eligible, Erwin Ants is eligible and exempt. We have Josephine Anthony, verification request sent. Lance Arm has not been able to be verified. We've got some other reasons in here. So you'll be able to see the action that was taken, and then if a customer is not eligible or not able to be verified, if you click on that invitation, it will tell you a reason, and the CBO and DHS will be able to see what that reason is. Additionally, if there are Social Security errors, Social Security number errors, the super admin team can go in and remove that file in case it is another customer's Social Security number. Otherwise, the record will just stay here in the not able to verify row, and you will invite a new customer. So those instructions are all in the instructions that are in the file pod in the lower left-hand corner. We hope to have the control group information out by midweek, but it may not be until the end of the week. All right, so on our call today, do we have any questions about anything with the new cohort or the control group? Okay, so we're going to move on now to our presentations by our CBOs, and locally we have Catholic Charities and OAI who are going to be presenting. So I'm going to open up the phone line for Kendrea, and I'm going to let her introduce herself. I need to find her phone number in my list. 729. Oh, Kendrea, I don't see your phone number in here. All right. I'm gonna go to Krishina from OAI because I see her. So, Krishina.
Yes, I'm here.
All right. I'm going to pull up your website here real quick. But if you want to go ahead, introduce yourself and tell everybody about your program offerings.
Okay, no problem. Good morning, everyone. I'm Krishina Ingram with OAI. I am the program manager for EPIC. We have a number of programs. Primarily, we focus in the healthcare and in manufacturing. So for healthcare, we have program offerings for a clinical medical assistant, a certified nursing assistant, dialysis technician, pharmacy technician, and the sterile processing um, technician. And for manufacturing and warehouse transportation and logistics, we have offerings for CNC or machinists. We have forklift training. We have welding. And then we also partner with Prairie State College for CDL training as well. So for each of our programs, we do offer the tuition payment for the participant, and we do supportive services. We also we have another grant through the Department of Labor, so if the participants have children, we can dual enroll them in that program, and that program can cover child care. For the parents, what we do is we will cover the initial month, and we will assist the participants in making an application with Illinois Action for Children. And as they go through the program, once they are approved, for Illinois Action for Children, we will pay the copay for the parents up to 90 days of job placement or up to $2,500. So we do have those programs available for the DHS customers. Are there any questions or concerns that you all have at this time?
I have a question that the people might want to know. What are some of the employers that you have built a relationship with that you can refer people who have finished your training?
So we have a number. We work for healthcare. We do work with the advocate group, many of the advocate facilities on the healthcare side. We also work with Walgreens and CVS. For the manufacturing, we do have a number of companies that we work with, Berry Plastics. We work with Food and Paper in the City. We've also worked with Our Dog, which is in Dalton. So we have a number of employers that we work with. And when placing the customers with the employers, we try to make sure that they are able to get to the employer, whether it's through public transportation or through their personal vehicles. And we don't just, we do have that open conversation with them, let them know we don't want to set them up for failure. So there may be sometimes that employer is not a fit for a participant because of background or something like that, but we do work with the participants until we are able to get them properly placed.
Great. All right. So now let's see if we have any other questions from the audience. Juan wants to know, what is your placement rate? Do you take ABOTs for this program? Are there background limitations, and do you serve bilingual customers?
Okay, so we do have our placement. Sorry, first question. The first question was about placement rate. So for our placement, we are above 70% for placement in terms of over all of our programs, whether it's the EPIC or any of the other funding sources that we have. And then I'm sorry, what were the other questions?
Well, Juan, the EPIC program is all about ABODs, but we do take some voluntary customers, so I'm going to answer that one for you. And are there background limitations? So can a customer be a sexual offender? Can they have a violent offense? Can they are there any limitations on those kind of background items?
No, we don't have limitations in regards to a customer's background, but we are very careful to place them or to connect them with an employer that knows that background or is understanding of that background.
All right, and then the last question is, do you serve bilingual customers?
So we do not serve bilingual customers. We do have a staff member that is able to speak Arab, but we don't have a provider that we work with that is able to, that we've connected with that actually serves that population.
And then I just found out that Juan is actually Juanita Sanders, and she's asking now, is there any priority of service for ABODs versus volunteers?
No, there's no priority. Not from us. We accept them all. I'm
right.
sorry, Dee. We do have a one program that is kind of connected to the manufacturing that I failed to offer. This is through one of our other funding sources, but we have an internship program that is offered to male or female between the ages of 18 and 24 who are interested in manufacturing. So we do a 3-week career readiness program where they do receive their OSHA as well as their forklift certification, and then they go into a 6-week paid internship with hopes of permanent placement. And just like the rest of our customers that come through, if they are not able to secure a placement through that internship, we will work with them in other aspects in hopes of them gaining employment.
All right. All right. And then David Johnson from Northwest was asking, I recently had a client I signed up for EPIC who was interested in the medical assistant program. However, he rejected the program due to the training taking place in Park Forest. Do you have any training sites closer to the north side of Chicago for OAI?
So we do try to work with other training providers. We have, although they were assigned to OAI as the agency, we have partnered with colleges like Triton to be able to service our participants for technical training.
All right, but they would have to make a trip down to you every so often, correct?
Yes, yes.
All right. And, okay, and then David, if you want to check the list of eligibility for the new cohort customers when you are inviting a customer, since I still have my screen up here, if you are doing an invitation to invite a customer to the new cohort, this page, at the top of the invitation, it says view available EPIC training programs and providers. So you can take a look here and see, based on their needs, this might not show up a whole lot of medical assistance because we might not have the programs entered in test. But if you just pick health science and then put a zip code in, then you can see a list or a map of the programs that are available, and you can check that out there as well. Okay, I get it. Okay. All right, I was just trying to help those of you who might not know that. So, but you're on top of it. So, all right, Krishina, there was one more question. Juanita said and group of ENT, so I guess she didn't finish typing. You are a control group provider as well, are you not?
I explain that.
You're a regular SNAP ENT provider.
No, we are not. OAI is just the EPIC provider.
Okay, all right. All righty, so then that answers that other question from Juanita. All right. All right. I am going to check to see if I can find Kendria. If anybody has any other questions for Krishina, please type those in there. And then I'm going to look for Catholic Charities' phone number here. Thank you, Krishina, for joining us this morning. I appreciate your time and explaining your programs.
No problem. Thank you for having me.
All right. I don't see Kendria's phone number in the list, and I also don't see her on the call. So I'm going to wrap up our call today. We'll get Catholic Charities on the phone the next time we have a call. All right, so thank you everybody for joining us today. We will get the recording posted and get the notes out as soon as we can. If you did not already take a moment to check in, please do that before you leave the webinar. And remember that the handouts are in the lower left-hand corner. Have a great rest of your day. Bye.